Researchers across the globe are working to further understand COVID-19. Senator Michelle Benson, chair of the Senate Health and Human Services Committee, is seeking to help fund research in Minnesota.
Healthcare experts say that testing is key to opening up the economy and getting things back to normal. Are you satisfied by the progress of Minnesota's testing thus far?
I'm excited at how much attention is being paid to testing. I'm excited that we're getting better at building capacity, but I don't think we're meeting necessary milestones. For example, it's still taking 72 hours to turn around a test. So if you go in to have a test, you're quarantined for 3 days minimum. If it's over a weekend, it's actually longer than that. And so if it's about getting us back to work, we're going to have to turn those tests around faster. And I know our rural hospitals are having trouble getting some of the swabs that are necessary to actually perform those molecular based, so the PCR tests, which are the ones that tell you if you have COVID right now. And so we have a little way to go. We started on the path, and that we should all be happy about.
So we've talked about testing for people who currently have the virus, but there's also testing to find out who has already had the virus, which is called serological testing.
Right.
You have a bill that would fund the development of those tests. How extensive of this test are you envisioning?
And that bill is changing significantly because there's already some serological testing that's going on with the partnership between the Mayo Clinic and the university. So my mission in dropping that bill was to make sure that we are doing serological testing. I don't think we're rolling it out fast enough, but I think the University of Minnesota and Mayo partnership is going to be key to finding out what I wanted to know when I dropped that language. What I wanted to know is how present had the virus been in our community? How close are we to herd immunity? Very important when we're talking about infectious disease, particularly viruses. And it would start the process of helping us understand immune response. So are we immune to this particular COVID strain for a year, or are we immune for 5 years? Is it a strong immune response so that we know that even if another strain of this virus comes through, we'll be relatively well protected. So those were my hopes. We are very fortunate to have the University of Minnesota and the Mayo Clinic helping with those efforts here in Minnesota.
And so you would like to potentially offer more funding for them to continue those tests, developing more, so that we glean more information about how the virus works, how many antibodies you need, how long you may or may not be immune. So this is really more for ongoing development of information.
It's for clinically based testing, not the development of the test, but actually going out into the population and understanding who has been exposed and giving some confidence that we can go back out. If we find out that 50% of our population has already been exposed, I don't think that's the right number. But if we find out a significant part of our population has been exposed, we'll have more confidence that they can't then transmit the virus.
And so what is the timeline for this ongoing development? And as it rolls out, you know, I guess look in your crystal ball. What do you hope to see?
Well, I hope to see activity very soon, making serological tests purposefully available to the general public, but also a well-designed clinical testing strategy coming out of the university and Mayo in partnership so that we can do a statistically valid sampling of our population. But we have to have enough people exposed in order to have a clinically valid sample. So it's going to be several months before we start seeing that activity, but it's going to be years before we know what our immune response looks like. We're in this for the long haul.
And as we go forward, do you think Minnesota has the capability to mass produce these tests so that everyone can be tested? Because, you know, knowing how to do it and then actually getting it done, those are two different things.
Yeah, throughput is a huge issue, but we have, for example, companies that do 3D printing are helping print the swabs that are necessary to go into your nose and extract samples to see if the virus is present. We have a manufacturer, a 3D printing manufacturer, who's going to produce 1 million of those for us. The first batch of 50,000 should be available within the next month. So yes, once Minnesotans put their mind to it, we'll be just fine. But for now, we have to get everybody moving in the right direction.
Senator Michelle Benson, I want to thank you.
I am so grateful. Thank you.